Better.
Well, the beginning of March is just days away, and that's when Colorectal Awareness Month kicks off.
And Dr. Brian Sadowski with AnMed Health is joining us to talk a little bit about why raising awareness is so important to get people checked and to understand the dangers that are out there.
Yeah, so thanks for the invitation today. Colorectal Cancer Awareness Month is March, like you mentioned, and that's the month that we take to really reinforce the importance of screening, because colorectal cancer is a very common cancer. It's the #3 cancer in America in both men and women.
And people don't realize that, do they?
I don't think so. And the good news is it's very preventable. We have a very good screening test to look for precancerous growths, and then if we're finding those, we can take those out before they ever turn into cancer.
So what's the age when people should start getting screened for colorectal?
So that's a little bit of a moving target. It's interesting. So it's always been 50 years old. Back a year or so ago, the American Cancer Society and my specialty society, American Society of Colorectal Surgeons, has dropped that down to 45, because what we're seeing is that death rates from colon cancer in the over 50 population is actually going down. We're making good progress with this, but we're seeing more cancer in younger people. So there's actually a push to try to screen younger people.
And these other tests, and colonoscopy, of course, is what we're talking about with that level, that 45 level. But these other tests, you could do at any age?
So the testing to screen for colon cancer is paid for from a preventative standpoint, starting at age 50 or 45, depending on insurance companies. But if you have symptoms, you should definitely be getting checked earlier.
What are those symptoms?
So symptoms would be like bleeding or change in your bowel habits, either more diarrheal type problems, more constipation, abdominal pain, things like that are probably the most common things we're going to see.
Are some of those changes normal as you age, or is it all considered to be get it checked out?
Any of those I would consider a warning sign that should be checked out.
Okay.
You shouldn't be getting bleeding with your bowel movements. It shouldn't hurt to have bowel movements. Abdominal pain is not normal. So all of those alarm symptoms should be checked out, yes.
Okay, so is there a specific group that sees colorectal cancer more than others? Or is it everybody?
So everybody should be getting the screening like we talked about, starting 45 or 50, depending on what number or what recommendations you're looking at. It actually, we're seeing, so the general screening is 45 or 50. People with a family history definitely need to be screened sooner. So this is first-degree relatives with colorectal cancer, patients with inflammatory bowel disease like Crohn's disease, ulcerative colitis, they're at increased risk for colon cancer. So they're going to need to be screened earlier as well.
And so you should really be talking to your doctor about this and about your family history.
Absolutely.
And do we have to go to a specialist, or can we go to our family doc, have the conversation, and begin there?
Absolutely. You can start there for sure. And I think that's probably where most of the patients that come to our office and come to the gastroenterologist's office come from, is the primary care doctor makes that referral to us. But again, it never hurts for you to bring this up to your primary doctor, and they're usually trying to get people to come and fighting with patients who don't want to come. So if you bring it up, they're going to be more than happy to refer you to get this very important screening test done.
And it's an area of the body we don't really like to talk about or think about, but it is important, especially to talk to folks like you
Absolutely. Very important. I try to normalize this as much as I can, because it is a somewhat taboo subject in public discourse and whatnot. So we just really try to normalize it, and we have to be honest and upfront and open so that we get the important information as I'm talking to people.
All right. Well, all you got to do is sit down and talk to your doctor. That's it. It's a nice private setting. Get the word out there and explain what's going on in your life. Thank you for raising the awareness. We appreciate it.
Appreciate the invitation. Thank you.
Absolutely. And stay with us. Carolina's Family at 4. We'll be right back.